Hi, my name's Kelly McInerney. I'm a nurse practitioner in Vancouver. I currently work with youth and young adults who have substance use disorders. There's an opioid epidemic in North America, and many public health initiatives are underway to reduce the rate of overdose deaths in BC. The BC Minister of Health declared a public health emergency in 2016. My DNP project is specifically looking at our OAT program at Foundry, our youth clinic, where we started prescribing OAT in 2018. So it will be to evaluate that. The bill I want to inform you about concerns the treatment of patients with opioid use disorder. It pertains to the amendment made to Section 56 of the Controlled Drug and Substance Act in March of 2018, which removed the need for prescribers to apply for methadone waiver in order to prescribe methadone, a drug that's commonly used for opioid agonist therapy with people who have opioid addiction. I'd like to focus on the influence of the legislation on nursing and its impact on the treatment of opioid use disorder. There are many studies that indicate that OAT, opioid agonist therapy, can decrease overdose deaths, emerge visits, rates of incarceration, and reduce infectious diseases such as HIV and hepatitis C. Section 56 is a federal bill applied across Canada, with each province and territory enacting its own standards for prescribing. This presents just one strategy to remove barriers to accessing addiction care. There is background and support for improving access to OAT, which I think is important to understand. A few key historical details that highlight the political climate related to the opioid crisis in BT that led up to the amendment. Interestingly, NPs were only legislated to prescribe opioids in 2016. The nursing college worked very hard and strategized with key stakeholders, including government, physicians, pharmacies, and NPs were required to complete a designated course in opioid management and register with PharmaNet prior to prescribing so that the college could monitor ongoing opioid prescriptions. In BC, with the amendment of Section 56, the management of methadone was shifted from the College of Physicians and Surgeons in British Columbia to our BC Center for Substance Use, which has issued new provincial guidelines for OUD, opioid use disorder, and has dramatically scaled up and increased access to providers getting education and training. The amendment to Section 56 has enabled NPs to prescribe OAT and acquire the necessary education and preceptorships needed to provide this very specialized care. The BC College, BCCNP, has implemented the standards, limits, and conditions for prescribing OAT in BC for NPs, and NPs have been strategically positioned to become major players in improving addiction care. This is really a new frontier for nursing.